Adolescence is, I think, one of the most important developmental stages in any person's life outside of, say, early childhood. And they're really at places in their life where they're making decisions that are going to impact kind of the next 5, 10, 15 years of their life. And so I think giving them the best opportunities as possible to excel, and doing that, we really have to treat the things that are kind of getting in their way, with increased prevalence of anxiety, depression, suicidal thoughts, suicide attempts, non-suicidal self-injury. RISE exists because we've identified that these issues continue to increase in our community.
We are family-oriented. Our Adolescent RISE program does include family therapy sessions and involves the whole family. It's what that person needs. It's the individualized care that we provide here. We find out what their goals of treatment are, and that's what we focus on while they're here. And in between that, we teach them all the skills to be their best self. It's really important professionally and personally for people to be their best self, and that is our goal.
There's in general been a real limited access to care in the community. People are utilizing the emergency room, and that doesn't always provide kind of the services that are needed. And so we really fill a gap between traditional outpatient and then inpatient hospitalization, which is kind of at the extreme end. What this allows is for kids to work on these important issues, build these skills, work on relationships with adults, but then still engage in the world. They go to school in the days that they're not here, they're spending the evenings at home. So it's a real opportunity to practice what they're gaining here in kind of the real world setting.
People need to know we're here. We don't want people to wait till they're so sick they have to go to the emergency room. Mental health can be treated sooner than an emergency situation, and that's what we're here for.
I think people deserve the opportunity to live a meaningful and fulfilled life. And I think if we can be a part of getting them there, that's kind of why we exist. I mean, there are a lot of people who are suffering in our community who feel alone and isolated and helpless. It's sad and unfortunate. I think if we can make a difference in that, we'll have done our job.